Thank you, Vedanshi. So, our next speaker is an orthopedic surgeon who is a blend of academic excellence and entrepreneurship with an interest in all the aspects of bones and joints. He is one of the most academically inclined and innovation oriented surgeons. He is coveted member of several bodies of orthopedic association and is dedicated to developing career in learning and teaching the advanced techniques of orthopedic surgery. He has been credited with more than 1,000 plus trauma surgery, total hip and knee arthroplasty, arthroscopy, and spinal trauma surgeries. Please welcome the doctor who has enriched the orthopedics in the hearts of all the PG aspirants through his instantly recognizable catchphrase OPD next patient please, Dr. Tushar Mehta.
Hi. Good afternoon, everyone. Hello.
Hello, sir.
Yeah, am I audible to all of you?
Yes, sir. Yes.
Chaliye. That's good. So first of all, thank you so much for having me here, and it's really a matter of honor and pride to be a part of this conference, which is conducted by the young inquisitive enthusiast of the medical fraternity. And I would certainly first appreciate the speaker prior to me, Dr. Shah. Actually, what he spoke about was something which is certainly very much required in today's time. As far as I'm concerned, I'm an orthopedic surgeon, and I come from a small town in Haryana. And then, right now I'm taking care of my clinical as well as academic career. So I'm an orthopedics faculty with Delhi Academy of Medical Sciences, DAMS. And apart from that, I have created my own portals for education and for clinical approach as well. Is there some I think some network issue? Am I audible?
Yes, sir, you are now.
Yes, sir.
Okay. So I think some network issue from my end, I think. Am I audible to you guys?
Yes, sir.
Yes, sir.
चलिए मुझे खुद को वो feedback नहीं आ रहा था. Okay, so basically this conversation that we are going to have today, that is about, as you must have seen in the post also, so it is about the journey that is from clinical to academic. I'll first take you in the beginning. So basically, I come from, as I said earlier, I come from a small town in Haryana. The place is called Bhiwani. I come from a family of doctors. When I was in school, the only identity I had that, I am son of so-and-so doctor. So I was little, of course, I was academically good, but at that point of time, the identification that I had was from my father. And it happens. Most of the boys who are listening to this will correlate to this, that, as you grow up, you kind of have a identity, crisis, and you want to be identified with your own identity. So I always wanted that, I should be known by my name. So that was some kind of a zeal that I had. And I always wanted that apart from my father's name, which is certainly, a blessing for me, but I should have my own identity. But the biggest problem was that how to go about it, how to approach it. Wanted to become a doctor, there was no doubt and there was no confusion in that, but the only thing was that how do I cross the barrier of course internet was not there, we never had any Zoom, Facebook or anything. So how to get myself tuned to the metro city, like Delhi was closest to us. So that was certainly a very big problem for a person like me. So all said and done, I crossed my 10th, and then I crossed my 12th, and got selected into the PMT. So when I was in my medical college, then you enter into a medical college, since I can presume most of us who are listening right now are MBBS students and maybe interns and post interns. When you enter a medical college, even in those days and even today, you feel a kind of little relieved. Like first year, when I entered into the medical college, I was very much relieved. I thought that my job is done. Okay, that's all. I'm sorted. I don't think there is anything else which is required now. So keeping that in my head, in my first year, I became very relaxed. Of course, I was very good academically, but I was a bit relaxed. Like I was focusing on anatomy, but I was not focusing on other things. And I thought that the half of the thing is done, and I've achieved the game, and now I will definitely become a doctor. In those times, the competition for PG entrance was there, but we were not oriented about it. I mean, the problem was the lack of orientation. I'll be very honest. लोगों को पता ही नहीं था एग्जाम था टफनेस था सब कुछ था everything was there but people were not oriented about it. So when I came to my second year, somehow I could clear my first year. When I came to my second year, then it was that moment I realized that no, it is something which is going to be a little tougher than this. So I started with the second year, did well, I was focused, I was doing good. Third year again, final year again. But by the end of the final year, I could analyze that yes, I was doing good in my, in my university exams. But somewhere down the line, I don't think I'm trained for the entrance purpose, or because you have to understand that there is a difference between PMT and PG entrance. Because in PMT, you are hardly having three subjects. You have pressure, but you are naive, you are young, you are full of enthusiasm, you have a dream, you just, even in your nights, you see a white coat and a stethoscope. So somewhere down the line, you are more enthusiastic than ever. But when you come to a PG entrance time, you're already 22, 23, you are 24 even, 25 even. So at that point of time, you have zeal, but you have a lot of distractions. And plus, 3 subjects in PMT to almost around 19 subjects in PG entrance. So at certain times, you fail to understand, the MCQ is in front of you, it is coming from which subject. But one thing was pretty clear in my head that, I wanted to pursue orthopedics. So that was my very clear view about that. Now, when it came for the time for the PG entrance, then I thought that, I should, maybe I should switch over to a bigger city for a better education. So I went to Delhi. I started, I started studying over there. I started, in the later half of the internship, I got a time and opportunity. So when I came to Delhi, that was at that point of time, I realized that I was probably, 100, 200 kilometers away from civilization. Internet is something which I can say today, it's a very big blessing, guys. You have to admit, this is the biggest blessing that one can have, because we never had in those days. Hamare time pe aisa kuch bhi nahi hota tha. We never had the exposure to even talk to people. We never knew what is going on in Ahmedabad, or what is going on in Delhi, or what is going on in Kottayam. We never knew anything. So when I came to Delhi, I realized that probably I was good in my medical college, but that is nothing. So when I came and when I saw all other students who are dropping and who are taking so much amount of pain and stress to, study for their dream, at that point of time, I realized that yes, it takes a lot more than what I have. So I started giving it more time, and then I felt that, maybe the hard work alone is not sufficient. It should be combined with the smart work. यहाँ पे एक point है which I want to emphasize to everyone, that whenever you have a vision, whenever you have a mission, there are only 2 things which are important. Number one, you should have a clarity in your head that why you started your journey. That why is very important. You have to think of the broader, the broader image of your goal. हम सोचते हैं कि we have a vision कि हमें ये goal achieve करना, और हम वो शुरू हो जाते हैं. No, but at every single point of time, you have to realize your head that why you started your journey actually. That why should be instilled into your head at every single moment. And the second thing is that whenever you're proceeding your journey, you have to understand that it is not always the hard work that wins. It is a blend of hard work as well as smart work. You should know when to get in a subject and when to get out of that subject. So probably I could realize in those days that yes, I have to make a balance between the subjects. And the only word which I realized after coming to Delhi is the most important for any medical student is the word called coherence. The most important word in PG preparation is keeping sync and coherence. Because if you're not coherent with your anatomy and your radiology, then you are going to lose the battle. You have to sound coherent. You have to study coherently. Because if you focus only on anatomy and you ignore radiology as a short subject, then you are not going to crack the exam. I'm sorry. So in Delhi, back there in those days, I realized that coherence is the only word which I have to learn here. Of course, that worked for me. My dream was orthopedics. I ventured into orthopedics. When I came into the world of orthopedics, it was altogether a new word. Now, I have spoken about, a bit about the people who are into the phase of MBBS. Okay? You have to understand that while you are doing MBBS, I don't know about you all, but when I was in my first year, I'll repeat that again, I had a vision in my head, ki ho gaya. my dream is over. It's all sorted. मेरे को जो चाहिए था मुझे मिल गया. I've become a doctor. White coat, stethoscope. Nothing else is required. And probably it happens, at times when you are in a medical college, you feel that, you are running the place and you are, taking care of the thing. So there's a dialogue in Rang De Basanti, so ki gate ke is taraf hum duniya ko nachate. I want to tell you ki gate ke us taraf duniya to nachayegi. So in a medical college, at times you have this, tendency that goes into your head that, people are there for you. But when you step out of that place, you fight with lakhs of people for selected PG seats, you get to know that life is, far more difficult than this. And then I'll tell you, when you sort that out, when you enter into a branch like I did, then again there is a heartbreak. अब मेरी बात को समझिएगा, दिल फिर टूटता है, मेरा बहुत टूटा, because when I ventured into orthopedics for the first 1 month, I was amazed. I was amazed by the kind of ignorance that I got from the department. Surgical branches are like that. If agar koi PG kar raha hai, use malum hoga. So in a surgical branch, it is a very difficult job to make sure that you are in sync with your seniors. We were standing 12 hours in a day. We were holding, the limbs of the patients while the surgeries were being done. The traction kit is not working. We were supposed to apply traction. For a minute, I thought that I would just step on a red carpet and there will be, people around me giving me knife and scissors and osteotomes and scissors and drills, and life will be a cakewalk. Life is not a cakewalk. Life is not a cakewalk in PG entrance. And believe me, when you enter into post-graduation, the only extra thing that you have in your life is another 10% respect from your family and friends. सिर्फ 10% इज्जत और मिलती है परिवार में, और कुछ नहीं मिलता. So वहां पे आने के बाद I realized कि bloody hell, when I came into the medical college, I thought my dream was over. It was not. When I ventured into orthopedics, I thought my dream was over. It was not. And that was a kind of heartbreak that I had. And of course, I'm sure many of us will understand कि heartbreak वैसे भी चलते रहते हैं medical college में. So there was another heartbreak which was going on, and there was a professional heartbreak that I had. मेरे 2 heartbreak इकट्ठे चल रहे थे. So I was like कि ये हो क्या रहा है, ये चल क्या रहा है? How am I going to manage this? It is so difficult. I used to cry. I'm telling this on a national platform. I used to cry. It is okay to cry, and it is okay for the boys to cry. Don't take it on your heart कि नहीं ऐसे नहीं होता, वैसे नहीं होता, लड़के रोते नहीं, बिल्कुल रोते. I used to cry. I still remember there was a bucket of the hostel, and there was a chapdi wala over there who used to sell tea and samosa and all. I used to sit under a tree and I used to cry. One of my seniors was very kind to me, used to come, used to console me, used to tell me everything will be fine. I said, boss, I think I've entered the wrong profession, or maybe I'm the wrong man. I don't know. He used to tell me, Tushar, nobody is wrong. It's just the timing which is wrong. And it is wrong for almost every postgraduate. It will be there. It will be wrong for maybe another 5 to 6 weeks or maybe months, and everything will be sorted. And then again, I started thinking of why I started this journey. See, I'll tell you, the only thing which will pump you every second, every minute, every day is that why. जिंदगी में जब भी हम सुबह उठते हैं, अगर एक दिन के लिए लगता है कि नहीं आज नहीं हो रहा है, monotony हो रही है, whatever, the only thing which is going to pump you is why. So again, I started thinking of my why, that why I started this journey 6 years ago. For 5.5 years of MBBS and 6 months of prep, PG prep. So I said, 6 साल पहले मैंने सफर क्यों शुरू किया था? इस दिन के लिए तो किया था, आज ये दिन मिला तो मैं रो रहा हूँ. So then I used to gather another, dose of confidence every morning, and I used to go to the hospital. Sometimes get abused, and sometimes get, sometimes they used to just heckle me like anything, and I used to come back. But somewhere down in the depth of my heart, I had a feeling that maybe one day I'll become friends with all of them. And then I realized that it is kind of a perpetuation process in the medical hierarchy of India, that a HOD is not supposed to be friends with a postgraduate student. Assistant professor is supposed to find out mistakes in you. Probably that is going to improve you. So all those people who are about to enter post-graduation or who are into post-graduation, please try to understand it's not a big thing. Don't take it on your heart. Don't take it on your head. It should not be, bonding on your nerves. Koi baat nahi. It's okay. It is the hierarchy. It is like that. There is a kind of a mutual respect which is hidden, but it will come out as you will enter into your seniority. So next year I was a senior, and when I was a senior, things were started settling down. Now again, you understand the feeling, the life of ups and downs. So now in my second year of post-graduation, I had another up. What was that up? Ki mere paas first year aa gaya. The way I used to get behaved, now I can behave with another person or maybe a couple of other people. But at that point of time, I started thinking that, what next? I started thinking of academics. Maybe I was not very good I was not one of the best in academics, but I could comprehend things. Now, when I say comprehend things, of course, the speaker prior to me, he was so learned. He spoke about many things, right from meditation to spirituality. Hats off to him. But there is one thing that I want to add. I think it makes sense for for the mankind. I think पूरी जो इस दुनिया के इंसान है, हम जितने लोग इस धरती पे रहते, if we get this one trait called as abstract thinking, I'm telling you guys, we will never fail in life. आप कोई भी जिंदगी में काम करें, आप डॉक्टर हैं, आप academician हैं, you're a businessman, you're an engineer, you're a president, you are anybody, you're a prime minister. If you have abstract thinking, your life is sorted. Now, what is abstract thinking? It's a fundamental of psychiatry. It is the ability of a mind to convert concept into generalization and generalization into concept. ऐसा मैंने पढ़ा है कहीं पे that a human brain achieves this capability of abstract thinking by 7 to 8 years of age. I can tell you, I'm a doctor, we all are doctors here, but I can tell you we acquire it almost after 35 years. हम डॉक्टर्स के साथ एक प्रॉब्लम है, हम एक कॉन्सेप्ट को जनरलाइजेशन और जनरलाइजेशन को कॉन्सेप्ट बनाने में 30 साल लगा देते हैं. Why? Because we are tubular. We have a tubular vision. हम एक ही दिशा में सोचते हैं, हम एक ही दिशा में काम करते हैं. And somewhere down the line, I was not finding it very good when I was in my second year. And I could feel that I have this capability of abstract thinking. So I ventured into education. I met one of the leading educators of the country, Dr. Sumer Sethi. He was heading dams. I met him, kind of a like-minded personality, and I said that I want to enter into academics. I want to teach people. I want to teach them how to solve an MCQ. I don't want to teach them the content. Of course, I will, but I don't want to be a simple rote learner. I want them to develop this abstract thinking. So probably that zeal in me wanted me to venture into academics. So I took my first lecture in dams when I was in my second year post-graduation. It was hardly the beginning of the first month of my second year PG, and I took my first lecture in dams. And it is at that point of time I realized that yes, I can venture into this field as well. The reason was not that I'm a multitasker. Many people say you're a multitasker, you have multitasking capability. No, we all can be a multitasker. We all can do anything. The only two important things are you should start from ground level work. You should never become directly the boss of the company. You should know what is happening at the ground level. You should have the experience of doing that. And the second thing is, again, abstract thinking. It is simple. So that point of time, I realized that yes, academics is again a cup of tea. I wanted to add another feather in my hat, and I was enjoying it. Now, by the end of the third year, I was busy with my thesis and all those things, and I cleared orthopedics. I was, it was a DNB that I chose over the degree just because I was getting a degree in a peripheral city. I was getting MS orthopedics in a tier 3 city, in a tier 4 city, but I chose city over degree. That is something that I did it was a kind of a bold decision in my days, but I don't want you people to do it. I don't know, maybe I would certainly say that I was lucky. I chose Delhi DNB over MS orthopedics in a tier 2 city because I have had preferences for Delhi, and somewhere I could feel that, I don't want to go away from a big city because I had done my MBBS from, a smaller town, and I could feel that when you live in a small town, you are a little away from civilization. So this is what I felt in those days, but that's not binding today because of the internet and connectivity and everything. So when I cleared my third year, I did DNB. I cleared theory in practical in first shot, and guys, believe me, it was a rare phenomenon in those days. And when I did that, I could feel that yes, again, my journey sorted, my dream is over. I think I got my why. दिस इज व्हाट आई थॉट कि मुझे मेरा वाई मिल गया, मेरा तो काम हो गया, मुझे जिंदगी में और कुछ नहीं चाहिए. पीएमटी हो गया, एमबीबीएस हो गया, देन पीजी प्रेप में हो गया, पीजी हो गया, ऑर्थोपेडिक्स हो गया. लाइफ इज सॉर्टेड. तुषार, व्हाट एल्स यू नीड नाउ? यू आर अ सॉर्टेड गाय नाउ. And there is no MCH in orthopedics. Of course, there was one in Liverpool, but that is certainly not required. You can make good money here. Now, when I cleared my orthopedics, I joined Listen to this. This is very important. I joined a senior residency. Now, when I joined senior residency, it was hardly second or third month of senior residency. At the same time, I was managing lectures of orthopedics in DAMS as well. So I was coming back on a flight from Aurangabad. I remember it was a Sunday, and I met someone, and that someone, just out of a random conversation in a aircraft, that person asked me, he said, so what's your name? I said, I'm Tushar. I said, what do you do? I said, I'm a doctor. What doctor? PhD doctor? I said, no. I'm a postgraduate. I've done my post-graduation. I'm an orthopedic surgeon. He said, where hospital are you working right now? I told him. He said, are you salaried? I said, of course. He said, can I tell you something? I said, of course, why not? He said, Tushar, the way you have 4 phases of life, that first you are a child, then you're a bachelor, then married, and then, all those phases. He said, similarly, in professional life, you have 4 phases. First is salaried. You are a salaried guy right now. You wake up at 9 in the morning. You wake up at 7 in the morning. You reach your place at 9 a.m. in the morning. Your only tension right now, headache right now, is marking your attendance. Your job is over by 5. Whether the work is finished or not, you can leave. You go back home. You have a good time. You enjoy. You catch up with your friends. You make some phone calls. Tum relax karte ho, pair philate so jate ho. Only thing that is into your head is कि तुम्हें every month, by the 5th of the month or 7th of the month, your salary will be credited in your account. I said, of course. He said, but is that salary, are you very happy with the salary? I said, sir, who is happy with the salary? Nobody is. So even I'm not happy with the salary. Whatever amount that I get, okay, fine. He said, so this is the first phase of being salaried that you're enjoying. I said, of course. He said, the second phase is self-employed. He said, in a self-employed person, there won't be any headache of reaching a place and marking your attendance or putting your thumb on a biometric. Tum subah 8 baje utho, 7 baje utho, 9 baje utho, what time, whether you wake up, that doesn't matter. But what matters is that every day you have to dig a well, you have to take out the water, and you have to drink it. You will not enjoy the perks of being a salaried guy. You will have to make your identity on a daily basis. रोज कुआं खोदोगे, पानी पियोगे. The day you will not be able to do that, you will starve. तुम प्यासे मर जाओगे. पानी मिलेगा तो ठीक है, नहीं तो नहीं मिलेगा. He said that is the second phase. Whatever work you will do, it will be credited on your name. Whatever amount you will get, it will be credited on your name. So positive, negative, benefit, loss, acha, bura, today, tomorrow, everything is yours. You will not be bonded with anyone. You will not be employed with anyone. And that is the next step that I want you to do, young man. I said, thank you so much, sir. He said, and after that, maybe I'll meet you or not, since we are talking in an aircraft and no mobiles are working. There is a third phase. He said, the third phase is a businessman. You have to become a businessman. I said, what does that mean? He said, the way you are salaried right now, probably in weeks or months or years, you will become self-employed. A businessman is that who hires those salaried people, and some self-employed people maybe even, who work with him, so that whatever money they earn, some major part of it goes to them, but some part of it goes to you. He said, just like a hospital owner. You are an orthopedic surgeon, you run a big hospital, there are 5 other departments, you give them salary, 100 rupees if they earn, 70, 60, 40 goes to them, remaining comes to you. So whether you are working or not, maybe some money is coming to you. So he said, in that, the only catch is people management. You have to manage other people who are working with you. And fortunately or unfortunately, they are doctors. They are the most prestigious people, who are the most learned people, जिन्होंने जिंदगी में सबसे ज़्यादा पढ़ाई करी है. So you have to make sure that you give them due amount of respect. And you give them their due amount of credit, which they contribute to you. He said, in that, it is kind of basically, it will be a human management. It will be a HR management, human resource management. You have to manage people who are working with you. And that will give you probably an identity. Because in the life, he said this line, in the life, it doesn't matter what you do for any other person. In the life, what matters is how you make the other person feel. So if you feel them honored, if you feel them respected, they will be honest to you and everything will be fine. Now that kind of clicked me again. So I said, sir, you have said the most important thing here, that right from salaried, I can be a self-employed, I can be a businessman. So maybe, sir, I will think of this. He said, no. But there is one more thing. I said, what is that one more thing? He said, there is one more thing that I want you to become, that apart from this, you can start another venture, maybe into academics, maybe into any other thing, maybe pharmaceutical or anything. And Tushar, I can tell you that you will become the 4th phase. That will be the 4th phase of your profession. That is what is called as an entrepreneur. So way back 10 years ago, he told me the first phase of salaried, which I was, the self-employed, then businessman, then entrepreneur. He said, you will just invest your intellect, your knowledge, your money, your time, and you will not do any hard work. Rest of the people will manage the hard work with your intellect, and whatever they earn, they take their share, 70, 80, 90%, and remaining comes to you. Guys, it was 12th of August. I was a senior resident. My 24-hour duty was on 15th of August. I did that duty 16th morning. 16th was my off. 16th morning, when I was leaving the hospital, I informed the HR that today is my 24-hour off, and day after tomorrow, I'm coming to settle the NOC and everything, and I'm not going to continue. They said you have to serve 1 month notice. Otherwise, your salary will not be given. I said, that's okay. You can keep the salary. Not a problem at all. So I left my salary because I was not concerned about that salary. What I was concerned about is that I have a vision in my head that I'm leaving this phase of being salaried because I want to become self-employed, and because मेरे आगे बहुत कुछ था करने. उस फ्लाइट पे मुझे अगले 10 साल दिख रहे थे कि अभी तो यार फर्स्ट फेज पे फिर सेल्फ एम्प्लॉयड बना, फिर बिजनेस, फिर एंटरप्रेन्योरशिप. सो आई जस्ट वांटेड टू run and rush, and in that effort I did not even inform my family, and I took a step. Again. I don't want all these things to be there's a disclaimer in all those action movies, so not to be performed at home. So I don't want all of you to be so much amount of on an adrenaline high. But yes, I was lucky. I took bold decisions, I took major decisions, and I was lucky, and I was very lucky. I was very lucky that when I left that job, I came to another city. Like, there's a twin city in Delhi called Gurgaon. I got good opportunities. I became self-employed. I was working day in and day out for me. And then I ventured into a hospital. I opened one in my hometown. I opened one here. And then, things got pretty fine from there. And of course, education was going on in a parallel way. So what I'm trying to tell you is today that whatever you do, you have to understand that you have to have a larger picture in your head. You have to have a macro picture into your head, but at the same point of time, you have to focus and analyze every micro problem which is going on around you. You have to be a troubleshooter. You have to be a problem solver. You have to be a multitasker, but at the same time, you have to work coherently. आप ऐसे नहीं कर सकते कि मैं ये कर रहा हूं फिर ये छोड़ रहा हूं, ये कर रहा हूं फिर ये छोड़ रहा हूं. नहीं. A confused mind, I'll tell you, a confused mind is an ungrateful heart. Whether you like it or not, but I have a feeling in my head, any confused mind in front of me is an ungrateful heart. That means he does not believe in himself. He is not grateful to what he is today. वो कंफ्यूज हो रहा है, उसको डाउट हो रहा है कि मैं सही जा रहा हूं कि नहीं जा रहा हूं. इसका मतलब उसको खुद पे कॉन्फिडेंस नहीं है. He is not grateful to himself. So please don't get confused. So this is another lesson that I taught you at the end of my senior residency. But life was not, again, a bed of roses or a cakewalk after that. I ventured into my clinical career. I was doing good academically. DAMS was, going up and high, and we were also a part of it. And we took other centers also, and everything was fine. But at the same time, my clinical career was going through ups and downs because I was self-employed. I started a hospital. At one point of time, I remember I used to give a salary of around 17 lakhs a month, 17 lakhs a month, where I was getting hardly 5 to 6 lakhs of revenue from that hospital. It went for about 4 to 5 months. But then again, that was not a problem. Why? Because the rest of the, 10, 12 lakhs, I was managing from my other earnings. I used to slog every day. I used to work hard every day just to earn certain money to give it to another person the next morning. मेरी जिंदगी में ही चलता था. पूरा दिन मेहनत करके जो पैसा कमाता था वो अगले दिन किसी को दे देता था कि ये ले भैया तेरी सैलरी ले. Why? Because hospital is not working. But 3 months down the line, again I sat down. I had a shower and I had a good tea, and I sat down and I started realizing what is the problem. The problem was that probably we are trying to find out the solution without analyzing the problem. हम सब solution ढूंढ रहे हैं, how to make it work, but we don't know what is the problem. So I found out the problem. There were many pitfalls, there were many lacunas, there were many issues that we had in our setup. There was a problem with marketing, there was a problem with many other things, and there were some legal issues going on. So at that point of time, I realized that managing a hospital or working to make sure that your dream of a hospital is coming true, just being a doctor alone is not sufficient. And it is at that point of time, I still remember in 2014, I wrote a post on LinkedIn also that medical fraternity is nothing but an emotionally defined humans. They are the most unsuccessful business people. I personally feel today's scenario is changing. I've seen many people doing very good, but in my days, only 1%, only 1% medical people that had a good business acumen. ये सबसे बड़ी प्रॉब्लम है हम लोगों के साथ. हमारा बिजनेस अक्यूमेंट बहुत पोर होता है. And I feel very sad and I feel very bad today. The city that I live in, Gurgaon, it is famous for its healthcare. We have Artemis, we have Medanta Medicity, we have Park, we have Paras, we have Fortis, we have Manipal, we have Columbia Asia. 75, more than 75% of the healthcare revenue that the city or the country is earning is going to the people who are sitting outside the country. ये एक फैक्ट है. हमारे देश के जो लोग हैं जो अपनी हेल्थ केयर से एक पैसा दे रहे हैं, उसको पे कर रहे हैं, उसका 75% पैसा विदेशों में जा रहा है. सिंगापुर, हांगकांग, सिकोया, वेंचर कैपिटलिस्ट, पी फर्म्स. सो my aim of talking about this towards the end of my conversation is to tell you only one and one thing, guys. Please develop that acumen of micro entrepreneurship in you. You might be 22, 23, 24 listening to me. एक माइक्रो एंटरप्रेन्योरशिप आप अभी से लेके आइए अपने अंदर. ये बहुत जरूरी है. यू हैव टू हैव द अंडरस्टैंडिंग दैट यू आर नॉट गोइंग टू बिकम just a doctor sitting on a chair and seeing maybe 100 patients a day and managing one lab and one pharmacy in your clinic or in your 5-bedded, 10-bedded, 20-bedded hospital. No. Start the fundamental of group practice. Start the fundamental of 50-bedded, the most hospitable hospital. You go to any big hospital, any 500, 400, 300 bedded hospital, you will take at least 15 minutes to realize that where is the reception and where I have to get my form filled and where I have to pay the money and where I have to see the doctor. आपको 15 मिनट लग जाएंगे because they are hospitals but they are not hospitable. You have to understand. There are doctors but they are busy. Why? Because probably they have a lot of workload. So आपको ये 50 bedded का concept लेके आना. And I can tell you, the moment you will bring this 40, 50 bedded, the most ethical and the most hospitable hospitals, I'm telling you this concept of 500, 400 bed. Anyways, these hospitals are not making enough money, so they will vanish. Plus, Gujarat in 2010 taught me one thing. The concept of group practice. I went to see someone in Baroda and that doctor was supposed to come to the airport to receive me. He didn't and he sent someone else. And when I met that guy, I said, he introduced himself and then he told me that he's a pediatrician. The person who was supposed to come to see me and he was a friend of mine. He was again a pediatrician. So he said that my friend was busy in the hospital, so therefore I came to pick you up. Both were pediatrician. I had never seen that. I had never seen two orthopedic surgeons, two pediatricians, two surgeons gel along. नहीं होता, इंडिया में नहीं होता है. गुजरात में मैंने ये चीज आज से 15 साल पहले देखी. The concept of group practice, I for the first time in my life, I saw in Gujarat. When I say group practice, that doesn't mean one physician, one orthopedic surgeon, one surgeon. Of course, I mean that only, but two pediatricians working together. One is, going abroad for something or for some family or lesion, and the other one is taking care of his patients. The fraternity has to now stand united. If we are two orthopedic surgeons, I perform joints, I perform arthroplasty, and you're taking care of scopy and spine, of course, we can share the work, we can share the load, and we can make a big name, we can make a good name, and we can be more, हमारा जो credibility है वो ज़्यादा हो सकता है. This concept is gradually now coming up. This concept of daycare surgery, this concept of hospitable hospital is now coming up. Because at the end of the day, a person who is paying you so much, all he or she wants is at least some amount of hospitality, congeniality, and the most important part, empathy and sympathy. इंडिया के मेडिकल एजुकेशन सिस्टम से मुझे कोई शिकायत नहीं है. मैं आप लोगों को एक बात बता देता हूँ, मुझे कोई शिकायत नहीं है. Although I find it very stupid, I find it very weird, and I hope that things are improving now with the new education policy. Things should improve, but there is only one shikayat, there is only one problem that I have, that they don't teach. They certainly don't teach one thing to our medical students, and that is how to tackle a patient. Some of you might be feeling it weird कि ये क्या बोल रहा है यार, सारा ये तो पढ़ते हैं हम. नहीं, you work in a government medical college, you are studying in a government medical college, there are 700, 800, 900 patients coming in every day. You don't have time for anything. You have to just fill up the form, send the patient across, okay, यहाँ जाइए, report ले आइए, ये ले आइए, वो ले आइए. In that effort, you stop learning the art of empathy and sympathy. The most important part is sympathy is you feel for the other person. Empathy, you put yourself in place of the other person and then you feel for the other person. ये चीज बहुत जरूरी है. मैं इमोशनल होने को नहीं कह रहा हूँ. I'm not asking you to be emotional with every patient, but what I'm telling you is that for whatever 5, 10, 15, 20 minutes you are with the patient, you have to make sure that whenever that patient leaves your room, of course you are supposed to give him the best of the best treatment, but he should be psychologically fit, he should be psychologically fine, he should be psychologically treated by you, because every disease brings some sort of I want to inculcate the art of the fact that every student should have 1% component of being a psychiatrist. अगर आप सामने, मैंने आपको पहले भी बोला था, इस दुनिया में वो मैटर नहीं करता कि आप किसी के लिए क्या करते हैं, इस दुनिया में वो मैटर करते हैं कि आप किसी को क्या महसूस कराते हैं. आप किसी को पैसा दे दीजिए, person might not be happy or might not be thankful to you, but you do something for that person, you make them feel special, you make them feel honored. That is, I think, the most important thing. India के medical college में एक ही problem है, इज्जत नहीं देते. Majority of the department, I don't know whether it has improved right now or not, but I never got respect from any of my departments, any of my seniors. We used to stand. Nobody has ever asked us any cup of tea. I think a cup of tea would not cost more than 5 rupees. And if any doctor, senior professor, AP, reader, lecturer, अगर कोई ये बोलते हैं हाँ ठीक है 5 स्टूडेंट आए हैं 5 चाय मंगा लो इन्हें 5 चाय पिला दो 1 बिस्किट खिला दो, I think that is all what we need. So this is what I want from you. We should change. We have to change. We will change. आप अपने जूनियर्स के साथ मिलते हो, a cup of tea with a biscuit may not cost you more than 10 rupees. What is 10 rupees? 10 rupees is nothing. आप अगर एक 10 रुपए की चाय किसी को पिला देते हैं, whether you know that person or not, whether you are sitting in your OPD and you are having a cup of tea, and मैं कह रहा हूँ मत पिलाइए, even if you are sitting in a big corporate hospital, you are the head of the department and the patient comes in, you are having a cup of tea, you don't want to leave that cup of tea, it's hot, पीते पीते आप लेंगे, would you like to have another cup of, would you like to have a cup of tea? Of course the patient is not going to say हाँ सर 2 चाय मंगा लीजिए और बिस्किट, नहीं, कभी नहीं बोलेगा नहीं डॉक्टर साहब थैंक यू सो मच. Ice is broken, that patient is yours. वो बोलेगा यार इतनी रिस्पेक्ट कौन देता है मुझे? Please start giving respect to your colleagues, start giving respect to the fraternity, start giving respect to your juniors, start giving respect to the patients, start giving respect to the people around you. All those people who do their post-graduation from a government medical college, the biggest problem that they find while they come in a corporate setup is they don't know the dialect, how to talk to a patient. You are doing post-graduation from a government medical college. You are dealing with a lot of stress. You are dealing with a lot of patients. Every day there is a big OT list, and those poor people who come to a government medical college or a government hospital, you are dealing with them. So, आपके 3 साल के post-graduation में you develop a dialect which is good for them. You develop a dialect which is good for them, and suddenly you enter into a Zydus, you enter into a corporate hospital, you enter into a any other corporate hospital, and suddenly you see people who are coming in their 10 lakh, 20 lakh, 30 lakh, 40 lakh cars, and if you will have the same dialect, if you will have the same amount of ignorance, and if you will feel कि अरे हम तो डॉक्टर हैं, बात कैसे कर रही है हमसे, ये भगवान है, भगवान नहीं है भाई. You have to understand that the other person who is coming to you, who is paying 500, 700, 1000 rupees as the consultation fees, also deserves some amount of respect. He deserves a good amount of time. That time is very important. You have to give him time. In your government institution training, you dealt with quantity, not quality. In a corporate setup, if you join that, you have to deal with quality as well as quantity. If you really wish to give quality to all your patients, you have to make sure that you cut down on your quantity. आप मत देखिए ना, you please don't see more than 20 patients a day or 25 patients a day. Please don't operate more than 2 cases. Elective, okay, fine, I'll do this on this day, this day, this day. People, I mean, I've seen doctors giving me excuses. There's a heavy workload. No workload is heavy. You have made it heavy. मेरे पे तो नहीं होता. I have never taken a very heavy workload. I do elective surgery, emergency. I make sure that I give it to other people. Elective also, I make sure that I space them well, because the sanity of the mind is very important. Because if you're not happy here, how will you focus on that surgery? So whatever you do, whatever minimal amount you do, you make sure that you do it in the best of your way. That is the most important part. This is my tenure of learning, honestly, which I learned, but at every single point of time, I would like to repeat again and again, that it is going to be a tough journey. It is tough. It was never meant to be easy. Nobody told you it is easy. The moment you entered, the moment after 10th class, you took a decision, ki, Papa, I will take biology. I'll become a doctor. I'll become a cardiologist. I'll become a surgeon or a neurosurgeon. On that very moment, you somewhere in the back of your head knew that ye glorified hai, glamorous hai, par aasan nahi. You will get a lot of respect. I totally understand and appreciate that. But that respect was there in our profession. We had a kind of it was kind of an obligatory respect. Aaj se 10 saal pehle, Dr. Sahab. Dr. Sahab was the most important. Dr. Sahab was the most important word. Aaj nahi hai. Aaj, we are judged on the basis of our ratings. We are judged on the basis of practo. We are judged on the basis of some random guy posting on Facebook that there's a big Facebook group of 40,000 people, some random guy. How is your experience with Dr. Tushar Mehta? Please share. Anybody is open to write anything. Even if somebody doesn't know me or has not been able to take an appointment with me, will write shit about me. So at this moment, it is not an obligatory or a compulsory respect that we doctors are going to get. We have to earn that. How do we earn that? By being sympathetic and empathetic to the people around us. We have to focus on the quality, not the quantity, and it is the time to develop that tinge of micro entrepreneurship. I'm telling you guys, if you are 2-3 people working together, if you have a 30, 40, 50 bedded setup, the expenses are low. I mean, if at all you find any time, you can mail me. I'll tell you the performer, I'll tell you the branding, how to do that. Any 40, 50 bedded hospital, if we have 5, 6 good hospitable hospitals, I'm telling you, this concept of going to a giant hospital and getting lost in over there, this will be lost. I'll share one more example. Just yesterday, I don't remember the name. I got a message on Facebook. Certain messages on Facebook, they don't come to your inbox. They go to the others and spam folder. So I was checking the others folder and I got a message from one student and she said that her relative, I don't remember, I think it was grandfather, he's COVID positive and he is having some kidney disease, some stage 2 or something, and he's COVID positive and he has to undergo renal dialysis and he's deteriorating and they're not getting a proper dialysis center or bed or whatever. So I said, these are 3 hospitals which are nearby to your place. I can maybe call one of them. Otherwise, I'm giving you a number. You can call one of them and you can arrange a bed over there. So that is something, it is not going to take more than a minute for me. All I had to do was just to call some person and I said that this blah blah doctor student will call you and please see to it what best we can do. This is only 2 minutes were allocated to this task. After 10 minutes, I got a message from her that, sir, because of this help, I got 2 different places. I got 2 different places, 2 beds in 2 different hospitals, and now we are deciding that where to go. And she said, thank you so much for being approachable and all those things. I said, no, that was no need to say thank you to me. Just make sure that if tomorrow you are a pathologist, you are a radiologist, you are something, and if I come to you and if I ask you that, you have to, will you help me in this? Please do that. She said, no, sir, don't worry, sir, I'll take care of that. I will make sure that it is a kind of a chain reaction that I create. The younger generation is, I will be very honest, the younger generation is very much actively involved in this. As you grow old, you have a family, you have kids, you have a husband, the moment you come to work, you actually bring that entire tension onto your work. This is the biggest problem. So you have to be free, you have to be liberal, you have to take the correct decisions in your life, whether in your personal life, in your professional life, because coherence is the word. So whether personal, professional, religious, spiritual, psychological, social, Dr. Shah was talking a lot about spirituality. I totally agree. It is very important. But what I want is a kind of coherence in all aspects of your life. If you are excelling in one aspect of your life, whether it is personal, religious, or spiritual, and you're not doing good in professional life, according to me, according to my mindset, you're not doing good. तो बैलेंस बना के चलिए, कोहेरेंटली चलिए, आगे चलिए और जिंदगी में सब कुछ आसान हो जाएगा. And make yourself happy, because staying happy is the only bliss that we have today. I think we can take some questions.
Thank you so much, sir, for such wise words.
Thank you.
Any participants would like to ask any question can type in the chat box.
Yeah, I think I can see one question. Walcow has asked, I think about leaving medicine every day and the feeling. Okay, see, you have to understand that एक हिंदी में एक शेर है, हालांकि सबने सुना होगा आप लोगों ने, कि किसी को मुकम्मल जहां नहीं मिलता, किसी को जमीन, किसी को आसमान नहीं मिलता। तो आपको शायद ये लग रहा है कि आपको आपका मुकम्मल जहां नहीं मिला है, जिस वजह से यू हैव रिटन दैट यू फील दैट यू हैव a feeling that of leaving medicine. But listen to me very carefully, that whatever, wherever, whenever you will go and you will do, at the end of the day, it is not going to be, happiness is something that has to come from within. तुम आज चले जाओगे इंजीनियरिंग करने या कुछ और करने, हो सकता है तुम्हें वो भी चीज पसंद ना आए. So what I would say, that whatever you have in your head, because I assume that you're doing MBBS right now, so whatever you have in your hand and head, please follow that. बोलते हैं ना कि जब कुछ हाथ में आ गया है तो उसको बेस्ट बनाना चाहिए. You have to come out as the best version of yourself. So I think that is very important.
Thank you, sir. So there's one more question. Could you please elaborate on MBA after MBBS?
I was just talking about that. See, I have worked a lot on this topic, that MBA, about the after the MBBS thing. A lot of people have done that. A lot of people are doing that. तो आपको ये भी बोलूँगा कि I know a lot of administrators in hospitals who are. I know one person, like she's an MSc ENT, and right now she's running one of the biggest hospitals in India. So what I would like to say, that there is no issue, there is no problem in doing MBA, and particularly in doing MBA in the management, particularly the second year subject is usually they take up management, HR management. So there is no issue in doing MBA in that. The only thing is that you have to understand that there are certain prerequisites for it. The first prerequisite is that you have to have a very clear bent of mind that you are going to be just in the management without any clinical acumen. मेरी बात समझ रहे हैं? बहुत लोग ऐसे होते हैं जो ये बोलते हैं कि नहीं हम उसके साथ अपनी प्रैक्टिस भी कर लेंगे, and we will be seeing patients also, and we will be in the management also. That is not going to happen. Normally, every corporate hospital has a fundamental hierarchy: deputy medical superintendent, medical superintendent, then senior superintendent, and then the HR head and the medical director. So hospitals these days, they don't want MBA people as administrators. They want doctors plus MBA people as administrators. Why? Because if you're a doctor, it will be easy for you to gel along with the doctor. And if you're into administration, then of course you can run that, which is their wish from you. तो कोई बुराई नहीं है, बहुत लोग कर रहे हैं, बहुत लोग इसको करेंगे आगे. ये चीज एक बहुत अच्छी चीज है. मैं भी कुछ साल पहले, until last couple of years, I used to feel it's not that good a thing, but now I've realized it is a good thing. But the only thing is that you have to be very good in contact making. Number one. Number two, you have to be actually good at administration. So you have to be very, I would use the word, you have to be very enterprising. तो अगर आप नेचर से इंट्रोवर्ट हो, एंड इफ यू फील दैट नहीं, you don't like talking to much people and all those things, so don't take it. I mean, you have to be an extrovert, you have to be enterprising, you have to be good in making contacts, and the most important thing which I'd like to say in the end, that please do it from a good college. I mean, I've seen people who are doing MBAs after MBBS. Actually, आपको शायद आइडिया नहीं होगा, BDS के बाद बहुत लोग करते हैं. BDS के बाद, when they fail to clear MDS, or even if they clear MDS and they see that a lot of job opportunities are not there, BDS के बच्चे बहुत आते हैं MBA करने. तो आपको MBA अगर करनी है तो do it from a good college. Try for some business school. I don't know whether you have heard of it or not. ISB हैदराबाद है. अगर और ज्यादा आप करना चाहते हैं, LSB है, लंडन स्कूल ऑफ बिजनेस है, लंडन स्कूल ऑफ इकोनॉमिक्स है. तो मतलब आप करिए, बट ऐसा नहीं है कि आप अब आप पीजी, अब जैसे फॉर एग्जांपल आप पीजी करना चाहते हैं, तो आप, मैं आपसे पूछूंगा आप कहाँ करना चाहते हैं, बोलेंगे सर एम्स में करना है, KEM में करना है, मैं MC में करना है. तो ऐसे में बोलूंगा कि MBA भी ट्राई टू एम फॉर अ हायर कॉलेज, बिगर कॉलेज. So it's good, and people are doing it, and people are doing it really well. जुगल शाह ने एक और क्वेश्चन पूछा है, प्लीज एक्सप्लेन अबाउट एब्स्ट्रैक्ट थिंकिंग, पॉसिबली विद एन एग्जांपल. मैं अभी बोलता हूँ. द वन थिंग दैट आई सेड जस्ट नाउ about the MBA thing, Jugal, yahi abstract thinking hai. Till about 2013-14, I never had, I had never put MBA after MBBS as a good career option. I used to tell everyone कि क्यों करना है यार MBA, MBBS क्यों की थी, डॉक्टर बनने के लिए की थी ना, तो करो ना फिर अब उसको. The other student used to tell me, नहीं सर मुझे तो रिसर्च करना था, मुझे तो ये करना था, वो करना था. मैं बोलता हूँ देख भाई, 2014 तक मैं बोलता नहीं. If you have come to the medical profession, you have come to it for one reason, that you are supposed to be a doctor. No MBA and all, because they are just glorified, workers. That's all. A doctor, hai yaar, to you should have some respect and all. But right now, what I'm seeing is a lot of capital. Capital se mera matlab paisa hai. A lot of capital flowing in our country, in our healthcare from abroad, and that is giving all other. The doctors are now getting less packages as compared to these administrators. So, with passage of time, if you're aware of the things which are going around you, then I think you are having a probable capability of abstract thinking. मैं इसको एक लाइन में और summarize करता हूँ जुगल, जो मेरा personal बड़ा favorite line है. You have to be alert, you have to be awake, you have to be aware. मेरी बात फिर से सुनना. You have to be alert of what is going on in your life. You have to be awake what is going on in others' life, and you have to be aware that what is actually required in our life. So if you're alert, awake, and aware, you shall arise. So अगर आपके पास ये alert, awake, aware है, तो आप arise करेंगे. और ये abstract thinking का एक बहुत common concept है कि आपको मैं एक बेसिक बात बोलूं, आप उसका जस्ट निकाल लें, मैं आपको एक जस्ट दूं, उससे आप उस चीज को एक्सट्रापोलेट कर लें. सो आई थिंक दैट इज एब्स्ट्रैक्ट थिंकिंग अकॉर्डिंग टू मी. Scope in private practice versus corporate practice for the current generation of graduates. मैं एक चीज बिल्कुल क्लियर बोलूंगा. If you will see my Instagram also, if you will see my Facebook also, yesterday or maybe day before yesterday, I shared one of the pictures of an article by one of the leading gynecologist, Dr. Bajaj. मैंने उनका एक article share किया था that corporate slavery should be stopped now. I will never ever advise you. Maybe you can join in. I mean, after your MD medicine or MS orthopedics, you can join in a corporate hospital maybe for a year or two. You can learn the finish, you can learn the finish, you can learn the art, you can learn the quantity quality concept, and then you have to start your own thing. I just don't want you people to be salaried for 10 years, 20 years. I don't want you to do that. You have to have that DNA of micro entrepreneurship. You have to develop that skill of managing other people, managing 5 people in the pantry and 5 people in the OT and 5 people in the sanitary department. You can hire managers. You can do everything. मैं हमेशा प्राइवेट प्रैक्टिस के फेवर में रहूंगा. कॉर्पोरेट में भी ईयर और 2, बट देन यू हैव टू स्विच ऑन टू प्राइवेट प्रैक्टिस. कोशिश करिए ग्रुप प्रैक्टिस, कोशिश करिए 30-40 बेडेड और 20 बेडेड से यू कैन स्टार्ट. This is what my advice is for the current generation always. There is one more question from Mehek. Mehek, मैंने आपको बोला, I cannot take names here, but one of the leading administrators of one of the biggest hospital in the country, she is an MSc-NT. She did her MSc-NT, she was doing good, but then suddenly she realized that she can do better in the administration. She did her MBA, and right now, and I told you, she's heading one of the finest chains of private hospitals in the country. So MD के बात कर रहे हैं लोग, MS के बात कर रहे हैं लोग, BDS के बात कर रहे हैं. Again, आप उसमें देखिए ना कि उसमें क्या मैटर करेगा. उसमें मैटर करेगा how skillful you are, how intelligent you are. At the end of the day, coherence matters ना. आप इंटेलिजेंट है तो आप किसी भी फील्ड में जाएंगे, आप अच्छा ही करेंगे, आप बुरा तो कर ही नहीं सकते. Dr. Kena ने पूछा how to keep balance between academics and activities. I think Kena, you are also doing it very well. So आप बस I'm that sort of a person. I will say that they should go hand in hand. They should go 50-50. Academics is something, according to me, आप कभी भी you can catch up on academics. Like अगर थोड़ा time आप if you're in a medical college and if you are arranging some online conferences, so I think I will give an advantage that I think this is more important right now. ठीक है, पढ़ाई का क्या है, सब्जेक्ट क्या है, कर लेंगे, आज नहीं कल कर लेंगे, कल नहीं परसों कर लेंगे. So I don't think that is that much important. I think being into sports, मेरा ऐसा मानना है कि sports में होना या extra curricular activity में होना, I think that is more important, because पढ़ाई तो सभी कर रहे हैं ना, academics तो सभी कर रहे हैं, ये जो जितने भी subjects हैं ये तो सभी पढ़ रहे हैं, इसमें क्या नहीं है. So being into I always appreciate people who are more into extracurricular activities rather than academics. Of course, I wouldn't want them to score less. अच्छे मार्क्स आ रहे हैं, ठीक ठाक मार्क्स आ रहे हैं, आप पास हो रहे हैं, that's good. But extracurricular activities I think is more important. And when I ask you to keep a balance, then it is prioritizing. Like if you are near your university exams, I think then your priority becomes academics. But if you are doing it right now, अभी आपके एग्जाम नहीं है और आप कुछ इस तरह की एक्टिविटी कर रहे हैं, आप कोई कॉन्फ्रेंस कर रहे हैं, आप स्टूडेंट एक्सचेंज प्रोग्राम में जा रहे हैं, आप कुछ भी कर रहे हैं, these things they nurture you well. एक इंसान जो होता है ना, मैंने पहले भी बोला, a human being is an outcome of two things in life. One is nature, one is nurture. Nature is what we are born with. जैसे मेरी अपनी एक नेचर है, मैं ऐसा हूँ, मैं ऐसा हूँ, मैं ऐसा हूँ. कोई बोलता है ना मैं एक्सट्रोवर्ट हूँ, मैं एंटरप्राइजिंग हूँ, मुझे गुस्सा आ जाता है. कोई बोलता नहीं मैं इंट्रोवर्ट हूँ, मैं बात नहीं करता, आई एम मोर ऑफ अ शाय पर्सन. सो नेचर इज समथिंग वी आर born with, and I don't think that you can change your nature overnight. आपकी जो नेचर है वो आपके साथ है, मेरी नेचर मेरे साथ है. बट द सेकंड थिंग इज नर्चर. नर्चर इज पालन पोषण. आई एम नॉट टॉकिंग अबाउट द नर्चर ऑफ पालन पोषण ऑफ योर पेरेंट्स. वो ठीक है, पेरेंट्स जो नर्चर करते हैं वो ठीक है, लेकिन अभी तो आप पेरेंट्स के साथ नहीं हो ना, कोविड में हो, वो एक अलग बात है. बट इन अ मेडिकल कॉलेज योर नर्चर मीन्स योर फ्रेंड्स दैट यू हैव द बुक्स दैट यू रीड, the places that you visit, the movies that you watch, the series that you watch. So nurture is something which is very very important in this period of your life, because I presume आप सब लोग 18 से लेके 25 साल के बीच में हैं. So you are malleable, you are ductile. आपको चाहे तो अपने आप को कैसा भी बना सकते हैं. इस वक्त पे आप ऑनलाइन एक्टिविटीज कर रहे हैं, आप स्पिरिचुअलिटी भी सुन रहे हैं, आप एंटरप्रेन्योरशिप भी सुन रहे हैं, आप सब कुछ सुन रहे हैं, आप यू आर ओपन टू ऑल व्यूज. इससे अच्छी बात एक मेडिकल स्टूडेंट में और क्या हो सकती है. मेडिसिन तो सारे पढ़ लेंगे, लेकिन दुनिया को सुनना, समझना और अप्लाई करना, मेरे को लगता है कि वो एक बहुत बड़ी बात है जो कि आप लोग करते हैं. मुझे बड़ा अच्छा लगता है इस चीज. Some companies are providing business coachings for people who don't like to do MBA. Vijesh, I know Bindra very well. See, you have to understand that मैं कोचिंग वर्ड जो है ना, मेरे को ऑनेस्टली आई हैव सर्टेन इश्यूज विद कोचिंग. लाइक कोचिंग इज समथिंग व्हिच इज, आई मीन व्हेन आई से कोचिंग इज समथिंग दैट आई फील इट शुड बी यूज्ड ओनली इन स्पोर्ट्स. मेरा ऐसा मानना है. हमारे में मतलब आई डोंट थिंक दैट आई शुड बी कॉल्ड अ कोच, बिकॉज आई एम नॉट अ कोच. बिकॉज कोचिंग इज समथिंग जो सिर्फ स्पोर्ट्स में होती है. एक इंसान है जो आपको सिर्फ कोच कर सकता है, वो खेलने के लिए कर सकता है. जिंदगी में आप क्या कर रहे हैं, हम वी आर जस्ट वी कैन बी कॉल्ड अ गाइड, or maybe an informer, or maybe an organizer. I mean, I use the word organizer often. I don't want to be called as an educator sometimes. Teacher तो मेरे को बिल्कुल नहीं पसंद है. Anybody tells me, sir, you are a teacher. और teacher क्या होता है? I cannot be a good teacher because there are many people who are senior to me, and they are very much well formed and well informed about the subject than me. I'm more of an organizer. I organize the subject to you. I organize orthopedics to you in form of certain clinical cases, and I make it into the most palatable form. You listen, you hear, you feel them, you feel good, you go back home, you revise, you clear your exam, and that's over. So बिजनेस चलाने के लिए या हॉस्पिटल चलाने के लिए या ये सब चलाने के लिए कोचिंग इज नॉट रिक्वायर्ड. आई मीन कोचिंग नहीं चाहिए. एक इंसान जो अपने हालात से सीखता है वही सीखता है. तो आप पढ़े लिखे होने चाहिए और आप मेहनती होने चाहिए, एंड यू शुड हैव समबडी, लाइक आई वुड लाइक टू मेंशन अ वर्ड हियर, मेंटोर. There is a very high amount of respect for somebody called mentor. Like in a surgical branch, surgery, orthopedics, OBGY, ophthalmology, you cannot excel without a mentor. You have to have a mentor. आपको एक आपका वहां पे एक एलिजेड भगवान होना चाहिए आपका, जो आपका हाथ पकड़ के आपको बताए कि ये इंसिजन है, ये अप्रोच है, ये मसल आएगी, ये नर्व आएगी, और सुनो ये आर्टरी आएगी, हाथ हटा लो. So in a medical, like my father used to say, in a medical branch, patients are your books and wards are your library. But in a surgical branch, patients are not your books and wards are not your library, because majority of the learning has to happen in the operation theater. And in an operation theater, you whether you know the anatomy or not, but the moment you give an incision and blood comes out, life goes for a toss. So there has to be somebody sitting behind you or standing behind you, जो which you must be aware of कि चल यार कोई बात नहीं, अगर एक आधा कुछ कट भी गया तो ये संभाल लेगा. Or maybe he should be giving you a kind of a direction in the beginning कि ऐसे करो ऐसे करो ऐसे करो. So mentorship I think is a better word rather than business coaching. And मेरा ऐसा मानना है कि mentor ढूंढने से नहीं मिलता, ऊपर वाले ने mentor fix किए होते हैं. Mentors जो होते हैं ना, like I have a couple of mentors. Like in my education there is a mentor, in my business there is a mentor, in my profession orthopedics there are a couple of mentors. So वो ऊपर से आते हैं, वो मुझे भी नहीं पता वो मेरे mentor कब बन गए. I never knew that when I gelled along with them. I mean, I still remember that was my first day of my PG. I joined DNB Orthopedics, and the academic head of the department. He bashed me like anything, that you were supposed to come at 10 a.m. and you are coming at 11:30. I said, sir, I had gone for medical. He said, first you are supposed to come and join the department, and then you could have gone for the medical. Now that man, he was the reason why I cried on day one, and that man is one of the, I would say, not a friend, but yeah, kind of a friend, philosopher and guide for me today. तो ये धीरे धीरे अपने साथ हो जाता है. डोंट वरी, आप उसकी चिंता मत करिएगा. I think we have one question on YouTube पे कोई question है?
Yes sir, there is.
Yeah, YouTube पे question है. Dr. Suresh ने पूछा है, and I think it should be spoken about. Depression is more among students during exam. Your suggestion from them, sir, please. See, I will tell you one thing. Depression, I'm not a psychiatrist, but this is my viewpoint, that depression is something, if you are a medical student and if you feel that you are depressed during your exam, I wouldn't call it a depression. उसे हम एंजाइटी बोल सकते हैं, उसे हम नर्वसनेस बोल सकते हैं, उसे हम न्यूरोसिस बोल सकते हैं, बट आई डोंट थिंक इट शुड बी कॉल्ड एज अ डिप्रेशन. बिकॉज डिप्रेशन में, of course, मैंने बोला, I'm not a psychiatrist, but I think endogenous depression means that, it has to be a feeling of selflessness, worthlessness, and a low mood almost whole day. वो बोलते भी ना, the activity that was earlier pleasurable, you don't find any pleasure in it. So depression is a very discrete word. We should not use the word depression just for the fact कि एग्जाम में आपको डर लग रहा है. उसे हम डिप्रेशन की डेफिनेशन ना दें. इससे ना डिप्रेशन जिन लोगों को है वो बुरा मान जाते हैं कि अरे यार आप ऐसे कैसे बोल रहे हो. सो व्हाट आई पर्सनली फील बेटा इज दैट इवन इफ यूर इन योर एग्जाम डेज, इफ यू आर हैविंग सम सॉर्ट ऑफ टेंशन और नर्वसनेस और एंजाइटी और यू आर इरिटेटेड और whatever, you have to just make sure that whatever you have done in the past, you are reaping the fruits or maybe the bad fruit of that thing today. आपने पढ़ाई नहीं करी है तो आज आप डिप्रेस हो रहे हैं, आपको लग रहा है कि आप डिप्रेशन में जा रहे हैं. सो दैट इज जस्ट एन आउटकम ऑफ व्हाट यू हैव डन इन योर प्रीवियस मंथ्स और डेज और वीक्स. सो फर्स्ट ऑफ ऑल, प्रिवेंशन इज बेटर देन क्योर. सो फर्स्ट ऑफ ऑल, हाउ टू प्रिवेंट इट? प्रिपेयर इन टाइम, read in time, revise in time, remember in time. Make sure that you follow your 10 years, your books and your notes and everything in time. दूसरी बात ये है कि let us say there are 48 hours left for the exam and you feel that you're getting depressed, although that is just a pathological anxiety. Then at that particular moment, you have to be very, very mentally strong here. Like दुनिया में there is a concept of IQ. I'm sure everybody has heard of, बोलते हैं ना इसका IQ level ये. ऐसे ही there is a Goldman करके एक author है, उसने बोला there is a concept of EQ, emotional quotient. So your IQ may be high, you're very good in studies and you're very intelligent, your IQ level is very high, but at the same time your EQ should be high. You should be emotionally very strong here. So at times I used to feel, I feel the same. मेरे साथ अभी भी होता है, कभी-कभी मुझे लगता है that things are not in my hand. There is some work that I want to get done and there is something that I want to achieve, but it is not happening, and maybe I have given the best of it, and I start feeling that it is the end of the day or end of the life and all sorrows and miseries and everything. And then I make sure that the next morning when I wake up while brushing my teeth, I start feeling, first of all, I start having the gratitude and thankfulness to God for whatever I have right now. मुझे कुछ चाहिए, वो मुझे नहीं मिल रहा है, उसके लिए परेशान होने की बजाय मैं बोलता हूँ पहले शुक्रिया अदा कर लेते हैं कि आज जो है वो रात खराब होती है, आई अंडरस्टैंड, बट नेक्स्ट मॉर्निंग आई फील थैंकफुलनेस कि चलो जो है सो है. दूसरा, देन आई स्टार्ट एनालाइजिंग कि क्यों नहीं वो मिल रहा है, क्यों नहीं हो रहा, कैसे. सो व्हेनेवर यू आर हैविंग एनी सॉर्ट ऑफ स्ट्रेस इन योर हेड, जस्ट स्टार्ट थिंकिंग अबाउट इट, हाउ टू सॉर्ट इट टुडे एंड हाउ टू मेक श्योर दैट इट डजंट हैपन टुमारो अगेन. तो इफ यू आर फीलिंग पैथोलॉजिकल एंजाइटी, देन फर्स्ट थिंग इज क्यों हुआ ये, बिकॉज पढ़ाई नहीं करी है. दूसरा, इसको कैसे नहीं होने दूंगा कि आगे पढ़ूंगा. अभी क्या करूं, अभी वट एवर बेस्ट ऑफ द टाइम दैट आई हैव टू यूटिलाइज इट. आई डोंट वांट टू फॉल ट्रैप इनटू द विशियस साइकिल. पढ़ाई नहीं हुई, टेंशन हो रही है, वक्त बर्बाद हो रहा है. पढ़ाई नहीं हुई, टेंशन हो रहा है. सो regret on a wasted time is more wasted time. Always remember, बीते हुए समय पे पछताना और समय को बिताना है. तो इसीलिए make the best use of it, stay strong here, everything will be sorted. I don't think there will be any issue.
Thank you so much, Dr. Tushar sir. We are really grateful for the time and the effort you took to share your thoughts and experiences. Thank you so much, sir.
Thank you so much. Pleasure is all mine. And As I always say, these kind of conferences and these kind of initiatives by the young enthusiast of the country, it is very much required. I'm more power to you guys and my heartiest blessings for you all. आप लोग जिंदगी में सब आगे जाएं, अच्छा करें. मुझे खुद बहुत अच्छा लगता है सब देख के.
Thank you
Thank you.
so much, sir. Thank you
Thank
so
you.
much.
Thank you. Thank you.
I would also like to thank all the speakers for such a remarkable lecture. We are very grateful to have you here today. I would also like to thank all the participants for being such a wonderful audience and attending the first half of the session. Our second half of the session of the keynote speaker is at 4 p.m. I would request each and every participant to join in at 3:45 p.m. We have two more speakers in the second half. They are Dr. Hitesh Chawda and Dr. Sanjeev Phat. Thank you.